CPR is a combination of oral resuscitation and external cardiac massage. Its purpose is to provide oxygen to the lungs and reestablish cardiac function and blood circulation. First is to survey the scene to determine if the place and situation is safe, because the safety of the patient as well as the rescuer is the top priority. Then second, determine unresponsiveness of the victim by tapping or gently shaking and shouting.
Are you okay, Mom? Are you okay, Mom?
If the victim is unresponsive, you have to call out for help and activate the EMS if outside the hospital settings or internal emergency paging system if within the hospital premises. Position the victim in supine position and lying firm flat on bed and ready for CPR. So if the victim is in the bed, roll the victim onto his or her side and place firm the backboard or the cardiac board under the torso, and then roll back into a supine position. Next is you have to open the victim's airways using the head tilt chin lift method. Once the airway is open, place your cheek very close to the victim's mouth. Look for the rise and fall of the chest, and then listen and feel the possible breathing sounds. So if the injury is present or suspected, open the airway by placing the fingertips of both hands under the angle of the victim's jaw and pulling the jaw forward. This minimizes neck movement and placing the jaw in a lock position that enables effective airway clearance. Next is to locate the carotid artery in the victim's neck in the groove between the larynx and the large muscles of the neck, and then palpate and simultaneously assess for breathing and carotid pulse for no more than 10 seconds. If a pulse is present, continue to deliver breaths at a rate of 10 to 12 seconds or breath every 5 to 6 seconds. If the pulse is present, chest compression should not be performed. So if no pulse is present, begin chest compressions by positioning yourself over the victim with your shoulders directly over the victim's chest, and then place the heel of the one hand over the lower half of the sternum, avoiding the xiphoid process. Then place the second hand directly on the top of the first, locking it in a knuckle form, and then keeping the fingers up and off the chest wall, and then lock your elbows. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then after the 30 chest compression, return to the victim's head and open the airways as in step 5. And then deliver 2 slow full breaths, 1 breath per 1 second. And then repeat the sequence of 30 compressions to 2 breaths until the help arrives or pulse and breathing is restored. So the repeated cycles of breath and compressions are necessary to deliver oxygenated blood to the vital organs. So after that, you have to reassess for the return of breathing and pulse every after few minutes, and then resume CPR as needed. If signs of return spontaneous circulation or the ROSC is observed, such as patient movement or breathing, then place the patient in recovery position, which is the side-lying position. So the proper positioning during the ROSC helps maintain adequate airway and prevention of possible aspiration.